Hello all, I welcome my viewers and students to my YouTube platform e-Political Science, and today I'll be talking about a recent published article on philosophy of care, and this article has been written by our Honorable Union Minister for Health and Family Welfare, J.P. Nadda, and this is a brilliant article. So I'll be talking about this article. So I hope this article will benefit the students and viewers at large for locating the developments in health, infrastructure, and the development, how it has taken place. Now, we are talking about the article of philosophy of care, where we also need to understand how India has made strides towards equitable quality healthcare for all. Now, in 2014, India faced significant challenges, including gaps in infrastructure, trained human resources, availability of medicines and diagnostics, and service quality. Today, guided by a philosophy of comprehensive care focused on proactive well being, there has been a dramatic shift in the whole idea. Now, India's healthcare system, if we see, it has gone through a transformation phase. Now, over the last 11 years, driven by political will, enhanced funding, and a commitment to providing affordable, accessible, equitable, and quality healthcare for all. It reflects the Modi government's focus on building a robust healthcare system, prioritizing the well being of every citizen. Now, in 2014, India faced significant challenges, including gaps in infrastructure, trained human resources, availability of medicine, diagnostics, service quality. And if we see today, it is guided by a philosophy of comprehensive care focused on proactive well being. There has been a dramatic shift. The National Health Mission is the cornerstone of this whole idea of revolution, which is strengthening health systems, reducing maternal and child mortality, combating diseases, and promoting universal access to quality healthcare. More than 177 lakh Ayushman Arogya Mandirs, they are bringing healthcare closer to communities, and platforms like eSanjeevani and Telemanas have democratized access to specialist care. Now, the improvements which has come about in maternal and child health area, that is focused interventions has been there under NHM, which has led to improvements in maternal and child health indicators according to the UN maternal mortality estimation interagency group report. India has seen an 86% decline in maternal mortality rate, nearly double the global average decline of 48%. Infant mortality has declined by 73% as against a global decline of 58%. Now, if we see what has been the focus on preventive care, that as the burden of non-communicable diseases, they are increasing, preventive care has also been a focus. Now, this article by JP Nadda ji is talking about screening for oral, breast, and cervical cancers is being provided at Ayushman Arogya Mandirs. By May, nearly 28 crore were screened for hypertension, more than 27 crore for diabetes, and 27 crore for oral cancer. Now, it is this whole idea is also talking about strengthening immunization, how we can strengthen the whole program, which continues to be strengthened. Six new vaccines they have been introduced since 2014, with 546 crore children and 1.32 crore pregnant women vaccinated under Mission Indradhanush. We have leveraged the latest technology to build a WIN portal to digitize vaccination services, recording 10.68 crore beneficiaries and administrating 42.75 crore doses by May 2025. Now, if we talk about disease elimination, this idea is talking about the disease elimination and reduction. For example, polio free by 2014 eliminated maternal and neonatal tetanus in 2014, and trachoma in 2024. Malaria cases and deaths, they have dropped by over 80% between 2015 to 2023. We have reached the Kala Azar elimination target in 2023. TB incidence has reduced by 17.7% and mortality by 21%, as confirmed by the World Health Organization Global TB Report 2024. The missing TB cases, they have dropped from 15 lakh in 2015 to 1.2 lakh in 2024. Now, there have been improvements in healthcare financing also. Now, how it has improved the government health expenditure, that is, as a share of GDP, which has increased from 1.13% to 1.84% 2014 to 2022, while out of pocket expenditure OOPE dropped from 62.6% to 39.4%. The Free Drugs and Diagnostic Service Initiative has enhanced affordability and accessibility, with laboratory services available in 36 states, union territories, CT scans in 34 states, and teleradiology in 12 states UTs. The Pradhan Mantri National Dialysis Program has benefited more than 20 lakh patients, saving rupees 8,725 crores in OOPE. Emergency response systems like the National Ambulance Service and mobile medical units, they have extended services in the remote areas also. Now, this whole idea which is about care, the health, mission we can see under Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, which was launched in 2021, and it took the key initiatives which included the establishment of 18,802 Ayushman Arogya Mandirs, 602 critical care hospital blocks, and 730 district integrated public health labs. The NHM has engaged 5.23 lakh additional health workers, including 1.1 lakh community health officers. Introducing in 2018, the CHO cadre bridges the gap between the community level health workers and the medical officers. Now, the whole mission, the whole idea, the whole philosophy about building a foundation for universal healthcare. So, one can conclude that the last 11 years they have laid a foundation for universal healthcare. The nation is poised to achieve its vision, that is of accessible, affordable, and equitable healthcare for all. So, my students and viewers at large, I would request you to go through this article, which is an excellent article, which is articulating all the data that has happened from 2014 till now and how our healthcare system has improved. So, I wish you all the best and take care. And if you have any comments, any questions, queries, you can put a note there. I'll also be sharing the link of this article. Thank you. Have a nice day.